What's up, y'all? Welcome to the BirthFit podcast. I'm Dr. Lindsey Matthews, Can too. I'm your BirthFit founder and CEO. Welcome back. Today's short, efficient podcast is on DRA, diastasis rectus abdominis. And while I won't be able to get into everything, especially like my entire views and philosophy on DRA, I'm going to get into it. Just a wee bit, because there is nothing that irritates me more than watching another influencer or chiropractor or PT, somebody on social media that posts something like TA stepovers. And what they mean by that is transverse abdominis stepovers. Um, when they're just literally labeling some random movement as a diastasis healing exercise, because transverse abdominis is a hot word, especially when associated with DRA. But they have zero understanding of how the body works, how the body functions as an integrated system. So if you are a coach or a practitioner working with pre and postnatal clients, you need to understand what's really happening with DRA, diastasis rectus abdominis. And I guarantee it's not what most people think. So we're going to get into it a little bit, but I want to share with y'all. I usually have a masterclass, a workshop on DRA at least twice a year. And this is the most attended and also the best feedback. Like, this is like, oh, this was so mind blowing. I didn't realize any of this. So here's your little sample. Please sure to share this with anybody, any woman that you may know, any man, because men get DRA too, that is struggling with this. Note, if you have not listened to the episode that I did with the physiotherapist, Diane Lee, go back and listen to it. It's about a year ago. I guarantee it will blow your mind. But anyways, we're going to get into it here. Got some notes up. Okay. So what I want to start with first is the obsession with width. The obsession with width. Was a tongue twister, huh? And why I feel like, and many others do, why it's missing the point. In the misinformed fitness world, and I'm going to throw you chiropractors and PTs in there too. So in the misinformed fitness practitioner world, you believe that DRA is all about the gap, the width. Close the gap, you fix the problem, right? Wrong. That could not be further from the truth. While everyone is out there measuring a finger's width, and in the, let's call it the PT world, the physio world, 2 fingers breadth or smaller or less is considered normal. If the width is more than 2 fingers breadth, that's considered DRA. That's like kind of like just common out there. But that, like, just think about that. Like, my fingers are smaller than like a regular man's fingers. So what? It's weird. Anyways, while everyone's measuring finger widths and obsessing over centimeters, they're completely missing what actually matters. And let me tell you what actually matters: depth and functionality. Functionality. The linea alba, so that connective tissue that goes from the sternum down to the pubic bone, should be strong and taut, T-A-U-T. When it's not able to optimally contract, your fingers will sink in deeper when you palpate your client or your patient or yourself. That's it. That's an issue. A shallow 2-finger gap with good tissue tension is awfully perfectly functional compared to a finger that's maybe 1-finger gap, but you can like go all the way down. That's a problem. So here at BirthFit, I mean, right? We'd rather be cringe and fix and like address the functionality. But we don't fix DRA. We don't defeat DRA. Like though, if you are inside of a program that says we defeat DRA, what? First of all, your signs and symptoms of your body are communicating to you. If you're going to defeat DRA, you're defeating your own body. It makes zero sense to me. We don't fix DRA. We improve the functionality. All right. So the transverse abdominis. This is another thing I want to address. This is more than just your lower abs. Let's get anatomically real for a second. The TVA spans the entire anterior lateral abdominal walls, from your iliac crest, your hip bones, your inguinal canal, to your thoracolumbar fascia and your ribs, basically those bottom ribs, 7 through 12. And then the inserts on the xiphoid process, the linea alba, and the pubic bone. So it's literally that like a whole core set around your core, not just the lower abs. Oftentimes when I see people talking on Instagram about the TVA, they literally just point to the area between their hip bones and their belly button and like lower. No, it's everything. It's literally, it's thought of as the core set muscle. It's preparing the body for movement. It's a power absorption. It's a load transfer. And it does this by creating optimal task-specific intra-abdominal pressure in harmony with all the other muscles of the core. And this is what influencers don't tell you. Here's the secret. The TVA does not work in isolation. I kind of gave you a hint before. It works with the diaphragm. It works with the pelvic floor and the obliques as an integrated system. This is why you cannot simply just slap a TVA label on a ring row and call it ab work. This is why you can't just say, hey, we're going to isolate the TVA. This is a TVA exercise. Without intentional breath work and syncing up with the other core muscles, you're literally just moving your limbs around without intention. Intention matters. Reminder, all the core muscles work together plus task-specific intra-abdominal pressure. That equals dynamic core function. And for us at BirthFit, that's the main goal. We want a dynamic and stable core. So you've got to have those two things. You've got to have the muscles working together, and you've got to be able to manage your own internal pressure system. Write that down, star it, record it, transcribe it. I don't know what we do today. AI transcription. You need two things for a strong and dynamic core, and that's what we want here at BirthFit. I'm going to repeat it for a third time. You've got to have all the core muscles working together, and you've got to be able to create task-specific intra-abdominal pressure, aka manage your own internal pressure system. All right, so here's a little bit where things get interesting, and I know my practitioners will totally vibe with this or geek out or be like, this crazy lady, but I would see this a ton in practice, and this is where we're going to get into it a little more. And if you want to set yourself apart as a coach, vibe on this with me. Thoracolumbar misalignment or rigidity and sacroiliac joint misalignment or fixation greatly influence the approximation of DRA. Let me repeat that. If there's misalignment, if there's subluxation, if there's rigidity, if there's a fixed joint issue, anywhere from the sacroiliac all the way up to the thoracic spine, I would see this in practice as greatly influencing for the worst of women not being able to approximate their DRA. No one in the fitness world is talking about that because worlds don't collide because there needs to be a bridge, and I'm introducing you to that bridge. So this matters. Why does thoracic lumbar position, mobility, why does it matter? Because if your rib cage is flared or your thoracic spine is rigid, subluxated, your diaphragm cannot function optimally. Your diaphragm hangs out in that space underneath the rib cage. And so if there is less range of motion for that diaphragm, if the dimmer switch is on to the nerves, so then we can get into cervical spine. C3, 4, and 5 keep the diaphragm alive. So there you go, the nerve innervation to diaphragm. Let's talk about the whole spine, right? I was just trying to be literal with y'all, but here I go. Here's the chiropractor in me. If that dimmer switch is turned on to that, it's like down, right? The nerve is not functioning at its optimal capacity to the diaphragm. There's less power to the diaphragm. Remember, also, the transverse abdominis attaches to the lower ribs and the thoracolumbar fascia. So if there's any rib issues, thoracic lumbar issues from the mid-spine down, hello, you're messing with the TVA. The diaphragm cannot descend properly. It cannot ascend properly. The transverse abdominis cannot generate appropriate tension, aka try tightening a corset when only one side of the fabric is twisted. Not going to work. This creates compensation breathing patterns. This creates disruption in load transfer throughout the core. This creates a linea alba that experiences uneven stress, therefore preventing symmetrical approximation. Talk about the sacroiliac joint. The pelvis is the foundation of the core canister. The pelvic floor is at the bottom. It's that hammock that holds everything up, right? So if the sacroiliac joint is misaligned, is subluxated, is fixated, the pelvic floor is going to be asymmetrical, have asymmetrical movement patterns. It cannot function optimally. The TVA's attachment points at the iliac crest, the top of the hip bones there, they're going to be compromised. Force transmission from the ground up is disrupted. The container for our intra-abdominal pressure has a warped base, right? We have to be able to manage our internal pressure system. But if you're thinking about it, if the sacroiliac joint is off, it's like a dent in the bottom of the LaCroix can. When women develop compensation patterns that pull on the pubic symphysis and the lower linea alba, this happens as a result of sacroiliac joint issues. And to me, this explains why 66% of women with DRA also have pelvic floor dysfunction. Nothing in our body operates separately. It's one integrated system. You want to go down the rabbit hole of talking about inflammation, metabolic health? Your nutrition matters here too. We're just not going to go down it right now. DRA approximates from the top down and bottom up, right? So ideally, supra-umbilical, above the belly button, infra-umbilical, bottom up, we go towards the belly button. And the umbilical area is the last to approximate. The umbilical region experiences maximum stretch during pregnancy and has the thinnest, widest linea alba, making it the weakest point biomechanically. This is why it's the last to approximate. This is why women can show good approximation above and below, but still have that persistent pooch. And I say pooch with quotations. This pattern reinforces why deep core stability works, why it matters, why sit-ups don't work, why bicycle crunches don't work. Recent research has showed that women who did deep core stability exercises, so think abdominal bracing, diaphragm breathing, pelvic floor contraction, planks, isometric holds, dead bugs, bird dogs, hello, all the things we teach with breathing and BIRTHFIT basics. If women do those 3 times a week for 8 weeks, they showed significant improvement compared to those doing traditional ab exercises, the things I mentioned earlier, crunches, sit-ups, trunk twist. You couple that deep core strengthening exercises with sunlight and red light therapy, I'll get into that. You've got a great healing combo. Deep core stability exercises create optimal intra-abdominal pressure and coordinated core function that supports approximation from all direction, not just superficial rectus abdominis toning, healing, approximate. Like we're not just focusing on those washboard ab muscles. So if you're coaching somebody, if you're in practice, if you see a client or a practice member who says they're doing all the right exercises, but their DRA is not improving, start looking literally at the TL junction first and rib positioning, then go to the sacroiliac joint function and also what's going on in the neck. Look at their breathing patterns, look at their compensation patterns. Because sometimes exercise alone is not enough. You need those adjustments. You need that manual therapy because we've got to address the foundation, the structure. That's going to give you optimal results. So this is why BIRTHFIT basics, everyone needs to be doing those. This is why we start with breath and we start with a neutral spinal position. Life does not happen in the neutral spinal position. No, no, no. But healing starts there. We're not jumping right into, I say isolated in quotations, isolated TVA exercises. We're retraining the entire system. That's what we do. And I really strongly believe that you need to do this first. And then let's say you have an athlete or a client, a practice member that shows up and they've got compensation patterns. You're able to see these somewhere along the path of discovering where she fell apart on those foundational movements, aka those BIRTHFIT basics. BIRTHFIT basics are based on developmental kinesiology, and this is how we as humans learn to move from infancy to bipedal locomotion. So it's very much, I would say, very intentional in the healing process. All right, so diaphragm breathing, stability breath, movement progressions. That's what we do. We teach coaches and practitioners to assess functionality and not just measure the gap. We're literally bridging the gap. We are bridging the gap in so many ways. We're empowering women to understand their bodies as integrated systems and not just fixing the part. All right, so I know y'all wanted to learn a little bit more about, let me pull up my notes on this. Because the last workshop I did, I got into a little bit on sunlight and red light and how amazing that is. So we're going to hit that just a second. Let me see. Just a bit. And y'all, if this is like blowing your mind, just get inside the next workshop. Trust me on this. Okay. Sunlight is literally free therapy. And I thought of it this way and used it throughout pregnancy. It was like you've heard me say, like, I believe the sun is a portal to God. I sunbathed so much during my pregnancy. I was outside during my labor. I gave birth outside on our back porch. And then I utilized sunlight healing postpartum. It was so useful. And I strongly believe that it's one of the reasons why I did not have any core issues. No DRA, nothing. Not only did it help me and my circadian rhythm, but I believe it also helped my baby girl as she was very circadian and trained by like 6 to 8 weeks. That's amazing, right? So you couple sunlight with the BIRTHFIT basics and nourishing your body and honoring the process. I think that's, I just let you in on all our secrets. There you go. And I didn't mention this earlier, right? But hopefully we all know what DRA is. It happens when your rectus abdominis muscle separates and that linea alba, that connective tissue down the middle of your abs, loses tension and stability. This is generally considered normal in pregnancy. Like your body's making room for baby. It's a natural adaptation. Also, it's a sign and a symptom. It's not the root cause. There's something deeper. I will share with you, men can also get DRA. Back in the day when I was working in the sports performance world, there were men that had a little bit of central obesity that would have DRA. Right? It's their body's adapting to the stress imposed upon it. Another fun fact, babies are born with DRA, and they approximate their DRA by going through their developmental milestones. That's why it's so important for babies to go through those milestones in a sequential order rather than skipping, crawling, and going right to walking. We want to integrate all the fascial slings. And this is one reason why we at BirthFit created the BirthFit Basics based on developmental kinesiology, because I know you've already approximated your DRA once in your life. You can do it again. Here's a fun fact number 2. Women with DRA have significantly lower collagen levels in their linea alba. And this is where we're going to talk about sunlight, because collagen production is directly influenced by specific wavelengths of light. The healing wavelengths, red light, 630 to 680 nanometers, penetrates your skin and boosts collagen and elastin production. Those are the exact building blocks your linea alba needs. It's amazing. Near infrared light goes even deeper, reaching your fascia, your muscles, your connective tissue. It fires up your mitochondria, which literally is cellular health stuff. Like, this is cell health matters. It increases ATP production for repair, improves blood flow, and reduces inflammation. Y'all, morning and evening sunlight are naturally rich in these wavelengths. So go outside with your morning tea, coffee, bone broth. Sit out there, put your naked eyes inside the get the sun on your naked eyeballs, and do some BirthFit basics with your shirt off. You do that for 30 minutes, game changer. Research shows that light therapy combined with exercise is more effective for DRA recovery than exercise alone. Your body is literally designed to use light as a healing signal. So how to use this in your recovery? We have a 3-prong approach here at BirthFit when addressing any sort of core and pelvic floor dysfunction. And I know I've shared this before, but I'll share it again. We take into account patterns, your breathing and movement patterns, your nourishment, what are you putting in and on your body? So this includes sunlight, and mindset. Like, do you believe you can heal? Are you working with practitioners that believe you can heal? Like, that's the best place to start. And sometimes, the best thing you can do is go outside in the morning sunlight, put your hands on your body, and say, I am worthy of healing. And that might cause some tears to come up, and that's okay. That's all I'm going to share on that, y'all. I'm almost half an hour in, and I promised you these would be short and sweet. But hopefully I've challenged your limiting beliefs on DRA already, that it's more about functionality and depth than it is width. Go back and listen to the podcast I did with Diane Lee, because inside of that one, we talk a lot about the research and what the researchers said on TVA and the transverse abdominis actually widening when it's functioning optimally. It actually widens the gap on some people, but the functionality is amazing. So go check it out. We also talked about sunlight being the secret weapon. So share this. And y'all, I know I have a small and mighty podcast. I would really appreciate if you would leave us a review. That would mean a ton. Or what would be even more meaningful, I've already said this like 3 times, but share this podcast with somebody. Like, trust me, like this information needs to get out. It's not about me, it's about the information. All right, y'all, have a great week. Talk soon.